number one, any as far as for wrist, anything that you do, you want to make sure that you're always exercising in a comfortable range, so you're not really stressing the joints, and sort of in a mid range of the joint, so not to bring it to the extreme so you're putting more pressure or torque on the joint. I tell most of my patients who are either post-op or recovering, if you're working on strengthening stuff, don't do anything that you can't do 15 times, and that you can't do that, rest for a minute and then do another 15, and don't increase until you can do at least 15, maybe 3 times. So number one is take it slow. Your goal isn't to do these 5 repetitions of maximal strength. As far as hand strengthening, we only think of it. The question is it, why is the hand weak, right? Is it muscles in the forearm which control the fingers? Are they weak? Is it weakness because they're painful? The best thing to do is to resume normal activities gradually. I don't love sitting there squeezing balls or squeezing clay. They tend to be more stressful on joints. You can gradually do things. You can gradually just increase your activity level or perform more what we call functional strengthening, like use common objects and manipulate them and raise them up and down. But there aren't great grip ones. As far as working on, if it's pinch strength, like you're having trouble opening bottles and cans and stuff, there's actually a muscle which I like to point out to people. When you lift your index finger up, there's a muscle that kind of pops out, and that sort of stabilizes the base of the thumb for you. So I encourage people to work on sort of lifting that up and bringing the thumb across, and even resisting that a little bit to try to strengthen and stabilize the base of the thumb, which is a very, very common area of arthritis. And sometimes people mistake the pain for actual weakness of the muscles.
I agree with everything Gary said. And some of the patients that I see feel like their hand is weak, when in reality, it's their shoulder or their elbow. And they are trying to substitute their hand for larger, stronger joints that should be doing the activity. And so I always tend to look a little more proximal or a little more up when patients are complaining about that weakness. We know that wrist, being able to stabilize or co-contract the muscles around your wrist in order to lock it when you go to grip is really important. So wrist strength, strengthening the wrist muscles, I think, really does improve the hand grip quite a bit. Then looking at making sure that the shoulder is strong and the elbow is strong, and that they're using those proximal muscles, because the hand muscles and wrist muscles are really there for finesse. Those are your dexterity muscles, and those are your fine motor muscles. And they're not always your brute strength muscles. So being able to make sure that you're strong in the proximal joints would be what I would add.